What does medical jargon in brain scan reports mean? When you hear about a brain scan report, it might sound like a foreign language filled with complex words and abbreviations. But understanding what these terms mean can really help you feel more in control of your health journey. Brain scans like magnetic resonance imaging or computed tomography are crucial tools in diagnosing conditions like brain tumors. These reports are written by radiologists, specialists trained to interpret the images, and they use specific medical language to describe what they see. Knowing these terms can help you better understand your diagnosis and the next steps in your care. Most brain scan reports follow a clear structure. They usually start with the reason for the scan, called the indication. For example, the doctor might order a scan to investigate headaches, seizures, or suspected tumors. Next come the findings, which describe what the radiologist observed on the images. Finally, the impression summarizes the conclusions and recommendations based on the findings. Sometimes, the report will include details about the technique used, like whether contrast dye was administered, and comparisons to previous scans if available. Let's go over some common terms you might encounter. If the report says the findings are unremarkable, that means nothing abnormal was detected. It's a reassuring phrase indicating no signs of disease or injury. When the report mentions normal for age, it refers to changes that are typical as people get older, such as mild shrinkage or small white matter spots, which are usually harmless. A lesion is any abnormal area in the brain tissue. Lesions can be caused by many things, including tumors, infections, strokes, or multiple sclerosis. The report will often describe the lesion's size, location, and appearance to help determine what it might be. Terms like hyperintense and hypointense relate to how tissues appear on MRI scans. Hyperintense areas are brighter and can indicate inflammation, fluid buildup, or certain types of tumors. Hypointense areas are darker and might suggest old blood, calcifications, or tissue loss. Atrophy refers to shrinkage or loss of brain tissue, which can happen with aging or neurodegenerative diseases. Edema means swelling caused by excess fluid, often seen around tumors or after injury, and it can increase pressure inside the skull, causing symptoms like headaches or neurological changes. An infarct is an area of dead tissue caused by a lack of blood flow, commonly known as a stroke. The report might specify if the infarct is new or old. White matter changes are alterations in the brain's white matter, often seen as bright spots on MRI. Mild changes are common with aging, but more extensive ones could suggest vascular issues. When contrast dye is used during the MRI, an enhancing lesion appears brighter after the dye is administered. This often indicates increased blood flow, which can be a feature of active inflammation or tumors. Understanding these terms is especially important when evaluating possible brain tumors. For example, a report might describe a hyperintense, enhancing mass in a specific area, which could suggest a tumor. The presence of edema around the mass might explain symptoms like headaches or neurological deficits. Follow-up scans help doctors see if a lesion is growing or shrinking, providing insight into how a condition is progressing or responding to treatment. It's vital to remember that these terms are just pieces of a larger puzzle. The final diagnosis depends on combining imaging results with your medical history, physical exam, and sometimes additional tests like biopsies. Radiologists are experts at spotting subtle changes, but they do not decide on treatment plans. Your healthcare provider will interpret the report in the context of your overall health and symptoms. If you have questions about what your scan shows, it's best to discuss them directly with your doctor, who can explain what the findings mean for your specific situation. In summary, medical jargon in brain scan reports helps describe what is seen on the images in a precise way. Words like lesion, edema, atrophy, and enhancing each have specific meanings that guide diagnosis and treatment decisions. While some findings are common and harmless, others may require further evaluation. Always consult your healthcare team for personalized advice. Understanding this language can empower you to be more informed about your health. But it's important to remember that only your medical professionals can provide the full picture and appropriate next steps.